The air in the emergency room at Metropolitan General was a toxic cocktail. It smelled of antiseptic, stale coffee, and the metallic tang of blood. Underneath it all was the low, persistent hum of human misery, a symphony of beeping monitors, rattling gurneys, and the hushed, urgent whispers of the people who fought against the tide of death. Clara felt like she was drowning in it every single day. She moved through the chaos like a ghost, a pale figure in ill-fitting blue scrubs, her shoulders perpetually hunched as if expecting a blow. Her tasks were simple: stocking supply closets, changing linens on empty beds, mopping up spills that no one else wanted to touch. She was a registered nurse, but you would not know it. Here, she was just Clara. Slow Clara. Mute Clara. The nurse who seemed to startle at loud noises and who could barely make eye contact. The other nurses, hardened by the relentless trauma, had little patience for her. They saw her as a weak link, a burden. "Clara, did you restock Bay 3? The voice was sharp, impatient. It was Brenda, a senior nurse with a face etched by years of night shifts. Clara flinched, nodding her head. "Yes, I just finished." Her own voice was a quiet murmur, easily lost in the din. "Well, I need a suture kit, and it's not there. Did you just imagine doing it?" Brenda did not wait for an answer, pushing past Clara with a sigh of theatrical frustration. "Never mind. I'll get it myself, as usual." A few of the younger residents chuckled. Clara felt the familiar heat rise in her cheeks. She stared at her worn sneakers, wishing the floor would swallow her whole. She clutched her right wrist, a nervous habit. The sleeve of her scrubs slid up just enough to reveal the edge of a jagged, silvery scar that snaked up her forearm. She quickly pulled the sleeve down, her heart hammering against her ribs. The scar was a secret, a relic from a life she was desperate to forget. A life where she was not slow, or mute, or afraid. A life where she had been someone else entirely. But that person was gone, buried under layers of trauma and a desperate need for quiet anonymity. Metropolitan General, for all its cruelty, was supposed to be her sanctuary. A place where no one knew her name, where no one would ever look for her. The automatic doors hissed open, and the king of this chaotic kingdom strode in. Dr. Alistair Finch, Chief of Surgery. He was a man carved from marble and ego, with a brilliant mind and a heart of ice. He moved with an unearned grace, his expensive shoes clicking on the linoleum, a sound that made everyone stand a little straighter. Everyone except Clara. She tried to make herself smaller, to melt into the wall. Finch's eyes, the color of a winter sky, swept the ER with disdain. He thrived on this pressure, this power. He was a god here, dispensing life and death with the flick of a scalpel, and he demanded absolute, unquestioning obedience. His gaze landed on Clara as she was trying to discreetly replace a misplaced box of gloves. "You!" he barked. The single word was a weapon. Clara froze. She looked up, her eyes wide with a familiar, hunted expression. "Yes, Dr. Finch?" "I needed a number 10 blade in Trauma 1, 10 minutes ago. Where is it?" His voice was low, but it cut through the surrounding noise like a razor. I wasn't assigned to Trauma 1, sir. I was stalking." "Do I look like I care what you were assigned to?" he sneered, stepping closer. He was a tall man, and he used his height to intimidate, looming over her. "Your job is to anticipate my needs, but you can't even manage that, can you? You drift around this ER like a ghost, taking up space, breathing my air. What earthly good are you?" The world seemed to shrink around Clara. The faces of her colleagues swam in her peripheral vision. Some looked away in shame. Others watched with a kind of cruel fascination, the sycophants who orbited Finch, feeding on his power. Maya, a young nurse who had sometimes offered Clara a kind word, looked at the floor, biting her lip. She was too new, too scared to intervene. Finch was not done. He saw the box of gloves in her hands. With a sudden, vicious movement, he slapped it, sending the box flying. It hit the floor and burst, scattering sterile gloves across the dirty linoleum. "Now look what you've done," he said, his voice dripping with contempt. "Contaminated. Useless. Just like you." He stared down at her, a muscle twitching in his jaw. "Clean it up, and then get out of my sight. If I see your face again today, I'll have your license reviewed for gross incompetence." Tears pricked at the corners of Clara's eyes, hot and shameful. She knelt, her hands trembling as she began to pick up the gloves one by one. She did not say a word. She did not look at him. She just focused on the task, on the cold floor, on the humiliation that was now a permanent part of her existence. This was her penance. This was the price of peace. She repeated the words in her head, a mantra against the rising tide of a different, more dangerous emotion. An emotion she had sworn to keep locked away forever. Righteous anger. She heard Finch laugh, a short, ugly sound. He turned and walked away, his audience of residents and nurses trailing in his wake like pilot fish. Clara was left alone on the floor, a monument to his cruelty, surrounded by the debris of her own shattered dignity. She gathered the last glove, her knuckles white. She could feel the ghost of a different life pressing against the inside of her skull. A life where a man like Finch would never have dared to speak to her that way. A life where he would have been the one on his knees. But that life was over. She was Clara now, and Clara was nothing. The rest of the morning passed in a blur of quiet drudgery. Clara kept to the periphery, her head down, her presence so diminished she was practically invisible. She cleaned, she stalked, she fetched. She did everything she was told, her movements slow and deliberate. She was a machine built for menial labor, hiding the complex, high-performance engine within. The incident with Finch had settled into a cold, hard knot in her stomach. She could still feel the sting of his words, see the smirks on the faces of her colleagues. Around noon, the relative calm shattered. A call came in from paramedics, a massive multi-car pileup on the interstate. Multiple casualties, many of them critical. The ER exploded into a state of controlled chaos. Gurneys were lined up, trauma bays prepped, and the air crackled with a new level of urgency. "All right, people, listen up," Finch's voice boomed across the room. He was in his element now, the conductor of a grim orchestra. "I want trauma 1 and 2 for the criticals, bay 4 for the walkie-talkies. Let's move, people. This is not a drill." The first wave of patients arrived, a torrent of broken bodies and panicked cries. Clara was pushed to the side, instructed to help with triage tags and direct family members, tasks deemed simple enough for her to handle. She watched as the real nurses and doctors swarmed the incoming patients, a whirlwind of swift, efficient action. She saw Maya, her face pale but determined, starting an IV on a woman with a severe head laceration. Then, another gurney was wheeled in. It was pushed by a harried paramedic who was trying to bag the patient while running. "John Doe!" the paramedic shouted. "Unresponsive at the scene. GCS of 8. Found about 50 yards from the main wreckage. Looks like he was thrown clear. No ID, no phone. Possible internal bleeding. Definite head trauma." The man on the gurney was a mess. He was covered in dirt and grease, his clothes torn. He had a nasty gash on his forehead, and his breathing was shallow. He looked like a homeless man who had been in the wrong place at the wrong time. Anonymous. Unimportant. Finch gave the man a cursory glance as the gurney rolled past. His lip curled in distaste. Another one. Probably drunk and wandered into traffic. Stick him in the hallway. Get a saline drip going and wait for a CT scan when things calm down. Don't waste a bay on him. We've got actual priorities coming in. The order was given. A junior resident, eager to please Finch, nodded and began to wheel the John Doe toward a crowded corridor, a place where patients waited and were sometimes forgotten. But Clara, standing nearby with a clipboard of patient forms, saw something else. It was not the gash on his head or the dirt on his face. It was something small, something wrong. As the gurney passed, a faint, almost imperceptible scent hit her nostrils. It was sweet, cloying, like bitter almonds, a smell she had not encountered in years, a smell that belonged to dusty, sun-baked villages thousands of miles away, not to the sterile corridors of a city hospital. Her blood ran cold. Her eyes, no longer timid and unfocused, sharpened into piercing points of light. She scanned the patient. The head wound was a distraction. The pupils, she noted, were not just dilated from the head trauma. They were pinpoint, a classic sign she was trained to recognize. She saw the slight tremor in his eyelids, the faint blue tinge to his lips, almost invisible under the grime. And then she saw it. On the side of his neck, tucked just below his ear, was a tiny red dot. Not a cut, not a scrape. A puncture. A perfect, minuscule circle. Section dash, section. The pieces clicked into place in her mind with the terrifying speed of a firing pin hitting a primer. Head trauma was the wrong diagnosis. Internal bleeding was the wrong diagnosis. This was not an accident. This was an assassination. The man was dying, but not from the crash. He was dying from a fast-acting nerve agent, a binary compound designed to mimic the symptoms of a cerebral hemorrhage. The almond smell was the final confirmation. Cyanide derivative. Finch's order to stick him in the hallway was not just neglect. It was a death sentence. The man needed an antidote. Immediately. He had minutes, maybe an hour at most, before the toxin caused complete respiratory failure and cardiac arrest. Clara's carefully constructed world of meekness and fear crumbled into dust. The ghost of the person she used to be rose up, fierce and demanding. It was Captain Eva Rostova who looked at the dying man, not Nurse Clara. And Captain Rostova did not let her people die. She dropped the clipboard. It clattered to the floor, but she did not notice. She walked forward, her steps sure and deliberate, her voice ringing out with an authority no one in that ER had ever heard from her before. Stop! The junior resident pushing the gurney paused, confused. What? Finch said to move him. Clara ignored him. She walked straight to Dr. Finch, who was barking orders over a patient with a compound fracture. She stood before him, her spine straight, her eyes blazing. Dr. Finch. He turned, annoyance flashing across his face. What is it now, Clara? I thought I told you to stay out of my sight. The John Doe, she said, her voice steady and clear. You've misdiagnosed him. It's not head trauma. It's nerve agent poisoning. A cyanide compound. Finch stared at her as if she had sprouted a second head. Then he laughed. A loud, incredulous, mocking laugh. Nerve agent? Are you insane? Did you get your medical degree from a television show? He was in a car crash. He has a head injury. Now get out of my way. Look at his pupils, she insisted, refusing to back down. The cyanosis of the lips. There's a puncture wound on his neck. He needs a full dose of hydroxycobalamin right now, or he will be dead in 30 minutes. The specific, technical term, uttered with such confidence, gave Finch a moment's pause. But his ego quickly reasserted itself. Who was this mousy little nurse to question him? The chief of surgery? I have had enough of your insubordination, he snarled, his face turning red. You are a nurse, a barely competent one at that. You do not make diagnoses. You do not question my orders. Now for the last time, get back to work. He turned his back on her, a clear dismissal. He then pointed at the John Doe in the hallway. And you, he shouted to the resident. Move him to the observation ward. No monitors, just a bed. We need the space down.